Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today my topic of discussion is about choroidal neovascular membrane, CNVM. This is basically the abnormal growth of blood vessels from choroidal vasculature through the Bruch's membrane into the retina. Yes, these is abnormal blood vessels which develop in a number of diseases. And basically there is a disturbance, an imbalance between angiogenic factors and anti-angiogenic factors. The imbalance which is created because of certain factors which lead to proliferation of these blood vessels. These blood vessels may be developing from the pre-existing, or they may be altogether new vessels. There are multiple causes, reasons for that. Usually we see patients with exudative age-related macular degeneration, pathological myopia, angioid streaks. Basically any type of trauma, injury, inflammation at the level of this choroidal vasculature, Bruch's membrane, there is a break, and these vessels develop whenever there is an imbalance. So this is the fundus photograph of one of my patients, and here we can see the accumulation of blood just under the retinal blood vessels, and there are also exudates over there. So this is a classical presentation of choroidal neovascularization, and there is hemorrhage, all these things happening. Basically, there are three types of choroidal neovascularization, which we call type 1, type 2, and type 3. As I mentioned earlier, that there are breaks in the Bruch's membrane, and through which these choroidal neovascularization is proliferating and entering into the retina. If they remain below the retinal pigment epithelium, it is type 1. If they go above retinal pigment epithelium, it is type 2. And if it goes into the retina, into the sensory retina, and proliferate over there, it is type 3. This is according to the depth. Sometimes we also consider that the location is subfoveal, juxtafoveal, or extrafoveal. Subfoveal is right under the fovea, the neovascularization. And when we talk about juxtafoveal, they extend maximum up to 200 micrometers from the fovea, while extrafovea neovascularization is more than 200 micrometer distance away from the fovea. So this is basically classification according to the depth and according to their location, which is very important in the diagnosis and the management. This is a choroidal neovascularization. In that same patient, we did OCT, and here we can see that the fluid, intraretinal fluid, is in the retina. The retinal pigment epithelium is elevated. So this is, we can say that it is type 3, where there is fluid intraretinal. Even we can see subretinal fluids over there. So this is aggressive form, we can say, and this needs treatment. So this is the OCT of the same patient which we have seen earlier, and we can see over there superiorly some macular edema in the form of the cysts and cysts, and the thickening has increased, and this patient definitely needs treatment, which was given to him, and we will see the further slides. Another slide, here we can see again the choroidal neovascularization, how it is disturbing the retinal architecture. There is intraretinal fluid which can be seen over there, and elevation of the ellipsoid zone, and even to some extent there is subretinal fluids also. This is another OCT photograph. Another OCT photograph, here again we can see that elevation of ellipsoid zone and hyperreflective layer is elevated over there, and minimal intraretinal fluid can be seen. This is another patient. This OCT, we can see intraretinal fluid in the form of cysts, and there is elevation, there is subretinal fluid. So this is also an active choroidal neovascularization. Till now we have seen different OCTs images in which there was retinal edema. We could see a disturbance of the retinal architecture and anatomy. But the thing which is very important nowadays is OCT angiography. When we do OCT angiography, we basically concentrate on the area which is outside retinal plexiform layer and 20 micrometer area of the choriocapillaris. That area is basically the main area which is involved, and this helps a lot. So let's have a look at this photograph. Here we can see the patient has got disturbance of ellipsoid zone, RPE architecture is disturbed, elevated, intraretinal fluid. To some extent we can say subretinal fluids also. But when we see over there in OCT angiography, this shows us particularly the localization of those red colored blood vessels. Those signals are over there which are precisely telling us the location and of these new blood vessels. So this is the new modality. Why it is very important? Because when we do treat patients, we later on come to know in the regular follow-ups about all these things, their decrease in the blood vessels, decrease in the thickening, all these things are told to us by these images. So OCT angiography is very important. Earlier we were doing fundus fluorescein angiography combined with indocyanine green, and still it is done, very effective. But because of the deep location of these blood vessels, fundus fluorescein angiography has some limitations. So when we have to use our tools, we have to rely on all these things. There is OCT angiography, fundus fluorescein angiography, and even OCT and FAS. So all these things help us a lot in making a good diagnosis and give us an idea about the success of our treatment. This is another OCT angiography. Here again you can see the intraretinal fluid, disturbance of RPE layer and subretinal fluids, and the localization of the choroidal blood vessels. As we mentioned earlier, that basically there is a damage and injury to choriocapillaris, and they break through the RPE and go into the retina, and then they cause over there fluid, blood, lipid exudates, all these things which initially cause metamorphoses, decrease in vision, and when they progress and they cause significant decrease in the vision. When we talk about these choroidal neovascularization, OCT and FAS is also very helpful in showing the micro level structural changes happening in retina and choroid when it is combined with spectral OCT. But it is a static type of investigation as compared to our classical fundus fluorescein angiography or indocyanine green angiography, where we can see the leakage of the blood vessels, pooling of the blood, whether it is sub-RPE or intraretinal over there we can see. And fluorescein angiography also helps us to see the retinal blood vessels and anastomosis, or between retina and choroidal vasculature. So it has some limitations, but it is also very effective in diagnosis and management of choroidal neovascularization. Whenever we talk about the management of these types of choroidal neovascularization, as I mentioned earlier, this is basically new blood vessels are developing over there, which are fenestrated, which are leaking over their blood. And when there is blood leakage, there are also lipid exudates, all these things causing edema and decreasing the vision over there. So we have to rely again on the anti-VEGFs, that is bevacizumab and ranibizumab. They are effective. They have to be given the patients regularly and regularly followed up to see their effect and success rate. Along with this, aflibercept is another anti-VEGF, very effective. When we use aflibercept, the number of injections, the duration between the consecutive injections is increased, so less number of injections. But as we know, with anti-VEGFs, the chances of recurrence are always there. Yes. So basically, the treatment is medical for these types of lesions, and surgery has been attempted, but it is not successful. For example, it was tried to move the damaged macular area away from one place to another so that it goes away from the choroidal neovascularization, and that is we call macular translocation. But it is not successful. It is with further consequences and problems and complications. So basically, this disease which we are talking about, choroidal neovascularization, happening in exudative ARMD, high myopia, pathological myopia, which I talk more than -9, -10 over there, the patients can develop angioid streaks, polypoidal choroidal vasculopathies, different types of tumors, inflammations. So basically, this disease is managed by the use of anti-VEGFs, and their regular monitoring and follow-ups to see their regression. I hope my today's presentation will be beneficial for my respected audience. I want to thank you for your attendance and attention. Thank you.